age, please, before we get started.
Myself, Vidhi Patel, and I'm 26.
Okay, nice to meet you. Okay, so I'm going to get started, and the examination is going to involve me looking, listening, and feeling. Would that be okay with you? Yes? Would you like to have a chaperone present?
No.
No? Oh, okay, all right. I will be doing some maneuvers which may cause you some pain. Please let me know if at any point you feel uncomfortable.
Sure.
Okay? All right. So we start, and now you've done the whole introduction, stamp, disinfect, right? Okay? And now you move on and you do the inspection, right? So you have a look, right, at the eyes. I'm checking for any conjunctival pallor. I'm checking for any signs of icterus, right? Checking for any ophthalmopathy, right, and xanthelasma, which may be present. Depending on what's relevant, you say that out loud, right? Okay? To check for conjunctival pallor, say, I'm just going to gently pull down on your lower lids. Is that okay? Perfect, okay? And see if there's any pallor, okay? Can I get you to say ah? Yes, okay? So have a look inside their mouth, okay? See if there's any ulcerations, dry mucous membranes, everything that we spoke about. And can you now stick the tip of the tongue to the roof of your mouth? Perfect, okay, so again, assessing for those things and oral hygiene and those kinds of things, okay? Yeah. So when you go for, you can do lymphadenopathy if you want, okay? The best position though is to stand behind the patient, right? So I'm just gonna scooch over here, okay? So I'm gonna be checking for any enlarged lymph nodes, okay? Yeah. Okay, so we start here, right? And just very gently under the mandible, right? Never, when you're palpating the ones anterior and posterior to the SCM, do not do them at the same time. Why? Because, yes, exactly. So you do them one at a time, right? So you palpate anterior and posterior, right? Okay, gently, and then above the clavicle, superior, yes, and then under the clavicle, right? And don't forget the pre-auricular, post-auricular, and then if you can just bend your head slightly forward for me, and then the occipital. Okay? Yeah. So that's for lymphadenopathy. Okay? All right. Okay. I'm gonna get you to lie down for me, please. Okay. So she's gonna lie down. Okay. Yes. And I'm just going to get you to lift up the gown. Now she's not going to do it now, but lift up the gown, expose the abdomen so I can see it entirely. And I'm going to drape you for your privacy, so you'll have a drape, right? So you can place it like so, right? Yeah. Okay. All right. So I'm going to start with inspection. Once again, we're paying attention to
distension, if there's
Yes.
any distension, erythema, any scars, surgical scars, symmetry, shape of the uterus.
Yeah, exactly. Okay, and we're also looking to see in what position. This is something that I didn't mention before, but I say it now. How the patient is lying, right? So are they in any distress, right? Is there a preferred assumed position, right? How they're lying, right? You see that now she's lying there relaxed and comfortable. The SP may act out, right? If it's something that's more acute, right? They may act out like it's painful, or clutch to their side. So you'll see that, okay? Yeah. So the other thing is, now she's perfectly in position. So this is the advantage of having the SP who's a doctor, but they will not do this.